Hi, I'm Tamara Thomas,
And I'm Jackie Shrigley.
and this is Urban Health Weekly, where we talk about urban health. So, what's going on with you? How have you been? I haven't seen you in ages.
Well, school's out. So we've been doing, we went to the community pool. There's been a little swim team, a little lessons,
Oh,
that kind of stuff. A little walking around town with the dog. We've been enjoying it already. We like it. We like a little summer action.
yeah, we finished school early as well, and so we've been going a lot to the playground, and I'm teaching her handball. So
Handball, oh my
yes,
God.
we go really early in the morning. We walk around the track, and then I teach her some handball. I'm trying to get
You
her
have the
to catch the
special
ball.
mitt? You mean just
No,
like,
she's too little for a special mitt. Right now, what we're doing is throwing the ball against the wall and then bouncing. So she's got to learn the hand-eye coordination of catching the ball. And
that
then
is
after
such
that,
a fun game.
it
That
really
is so
is.
fun.
Yeah, and it gets you. And by the time and then we go to the playground, and then by the time that's all finished, she's exhausted, which is tired kid is
Perfect.
Exactly.
Mission accomplished. Mission accomplished.
So let's jump into it with the medical news of the week. So first thing up, HIPAA and COVID vaccination, public safety versus right to privacy. So the big question is, can an employer ask about their COVID vaccine status?
I feel like they should be able to. It's an employee, and I know from when I worked at the hospital, we had to be vaccinated. Now, granted, there's patients involved, but this is a public health issue. So I really feel like you have to be able to be, your employer has to know about what your status is. That's my feeling, that the employer has a right to know. It's not a right to privacy. It's a right of, it's a public health issue. And you have the right to not get vaccinated, but I feel like the employer has the right to say, my employees are vaccinated, especially if you're dealing with the public. It's just got to be an issue. Your thoughts?
Well, according to employment attorneys, it is not a violation of federal law for an employer to ask an employee about their vaccination status. HIPAA in no way prohibits business owners and other individuals from asking people if they've been vaccinated. So
do you have to show ID? Do you have to show that you've been vaccinated? Do you think
that's another, I don't know if that's covered.
Okay.
So much fraud going on. That's an excellent point. Now, with so much fraud going on, with the little CDC cards and stuff like that, I don't know if everyone has adopted. We have in New York. Tell me if you have it in New Jersey. We have something called Excelsior, which is basically it's an app, and it's basically pulled from the state database. So put in your information, and once and it doesn't work until you're fully vaccinated, because I tried it after my first shot and it wouldn't allow me to pull in any information. It said, sorry, we got nothing for you. And then after 2 weeks after my second shot, I was able to,
Are you telling me this is an app? Like you can have it on your phone?
Yeah.
We don't have that here. We have
really,
a card.
It's an app you put on your phone, and it shows your vaccine status. It shows that you're vaccinated. It also shows, because some people will take okay, you've had the test. It also will if you went to like a city or state run testing center, it'll put that data as well and have that. Now, if you go to a private, lab, then maybe not. But, there are many that do participate. But in general, if you go to a city or state place and you tested negative, that information will come up as well.
Wow. So how did you learn about that app? Is that just public knowledge? Did they tell you about that when you get vaccinated?
I was reading about it. I get emails from Cuomo, you know, from the governor. And it was like, I know, but my
On the ball.
so it was like, you know, introducing Excelsior, and you know, they had like click here to download it and all that. So I was
Oh,
like,
maybe
oh,
they
great.
do have it in New Jersey, but I just don't know
You know
about
what?
it.
Go to
Maybe.
the state site and see if they have
Okay.
something like that. I can't imagine New Jersey not having something like that, especially with people being able to get a hold of the little cards and giving people fake vaccination information and stuff like that. Um, but yeah, so I think, and I'm always offering everywhere I go, I'm like, by the way, do you want to see my Excelsior pass? And they're like,
Oh,
we'll take your word for it. We'll take your, which makes me a little nervous because it's like, are you taking
how
every
many people are taking your word for it?
That's the thing. You know, a lot of people are just like, if you say you're vaccinated, you're vaccinated. You know what I think though? I think there's a lot of, people are just tired. They don't feel like getting into a fight. People, you know, and customers have just gotten so unruly about this whole.
I feel
so
sorry for
polarizing.
all those people who have to deal with the public. I mean, they
Yeah.
didn't get into, they're not working security. They're just, you know, they're working retail. They didn't sign up for that. I don't think that's reasonable. Goodness.
Yeah. And they still have to wear their masks anyway. So
Right.
I think at the end of the day, but you know, I think that's what it is. I think a lot of people are just like, you know, I can't, I don't have the energy. You know, people are getting beat up all the time. People are getting berated and having, you know, called out their name. And I think people are just like, you know what? I don't care. I don't care. You know, I care about my health and safety, which is why they're probably having such a hard time, you know, keeping and employing people in the service sector. But, you know, I think people are just, they just don't want it's not worth the trouble. It's not worth you ruining your day, or, you know, you end up
Right.
listening to 6 o'clock news or something crazy like that. But people, you can be asked, it's up to you, you know, not to want to vaccinate, but be on the lookout that it is well within your employers or even your friends' right to ask you about your the only way you're protected is like if your doctor, you know, says that damn Susie, you know, she just refuses to get that. That's Susie Horton. She just refuses to get the vaccination, and he's like,
oh, your doctor cannot
Yes.
report to
Right.
your employer, or okay. Very
right?
good.
They can't even talk about it over, you know, to their fellow doctors over, you know, coffee break or something like that. It's just, you know, so that's it. But other than that, it's fair game.
All right.
Next up, vaccine class gap. The news is basically saying, there was an article in the New York Times that talked about that what they're seeing is that people who are higher income educated people are getting the vaccination, and lower income, less educated people are not getting the vaccine. I haven't found that to really be the case though. What have you seen on the ground?
Well, it seems to be over where I live. There does seem to be a certain amount of playing out where people who've got like a college degree or whatever, you do get that feeling that they're more likely to be vaccinated. But I do know some people who, you know, I know a couple of professors who didn't vaccinate their kids, but they're already not vaccinating. So
they're anti-vaxxers, okay.
To begin with, I mean, there's some medical issues, so they probably had some medical reasons for it. So they're consistent. I'm not really seeing, but I just feel like people who are anti-COVID vaccine are really a mixed bag. You can't necessarily predict who's just suddenly you hear things coming out of people's mouths and you just didn't have you had no clue that was what they would be thinking, that you just can't predict who is going to be anti this vaccine. And I know some people worry that the vaccine came out soon. That's what I heard a lot, that they worried that it came out a little too fast. They're okay with it. They're cherry picking which vaccines they're okay with. That's not the same as
interesting. So that's not really the same thing as not wanting to be vaccinated at all.
Correct.
Really
like
just which
Yes.
one is not going to harm me. Let me see what
Right.
data bears out over
The
time.
people I
Because my
do
parents
know,
did that.
yeah, the people
Yeah.
I do know who are, college professors, they are all vaccines, nuts. So right from the get-go, they had some medical difficulty with one of their kids when he was really little. And so then they stopped all vaccines after that. But that was like years ago. So they're consistent. And then there's some other people that I just thought, I don't know what their college education is, but a couple play dates where, oh, we're not vaccinated, we won't be getting vaccinated. I was like, okay, but
Wow.
I didn't,
But they just laid their cards on the table like that and just
well,
said
because I laid my cards on the table. I said, we've had our second vaccine and Calvin's only had his first vaccine, at that time. And that mom was like, well, we're not vaccinated. She didn't specify why, but we were having an outdoor play date. So I didn't make a fuss about it,
Okay,
And,
that's interesting. That's
Yeah.
interesting. So my experience from what I've seen and heard rather is
Okay.
I've seen, very educated, high income people saying that I don't need it. I'm healthy and my
That's so shocking to me.
my healthy juices and my healthy diet will protect
My
me.
fantastic intake of vitamin D will cover all illnesses.
My acai berry smoothies will protect me from no lie, my acai juice
My
will
clean
protect me-
living.
will protect me from you exactly. My clean living will protect me. And then I have friends that are not college educated and saying no way. Absolutely shot. Yeah, I'm not playing around. I got vaccinated. So it's such a mixed bag. So I really am not sure how the New York Times came up with that data, or if that's even local information. I don't know. Time will tell. But it feels to me like, and tell me if what you think about this. It feels to me like there's a certain segment of the population who are not anti-vax. You're always going to have the anti-vaxxers, right? Like that's
right.
Yeah. But there's a certain population segment that if it were easier to do, they just do it. But part of the what I saw here is that people just got so fed up. The rollout here in New York was just so terrible that people just got burnt out. I think between the whole talk and the whole having to isolate and social distancing and mask wearing and all of that stuff and everything being closed. And then the rollout was just so prohibitive. It was just so restrictive.
It was so hard to get a vaccine weeks ago.
Oh, right. That only the most savvy, determined people with free time, right, would be able to get their hands on it. Because I tried for weeks, and the system was so cumbersome that by the time you found it, you find a date, then it's like you got to put your information in. By the time you put in all your information,
you missed your chance.
It's gone. The data is now gone, and you have to start the process all over again. And only a certain type of person would be able to, or have their assistant do that for them over and over. I mean, you're talking.
They had a lot of time on their hands to be able to do it.
Right, you have to have a lot of free time structure into your life. If you're like a regular, 9-to-5 person, you don't really have time to sit on your phone or sit on your computer and do that over and over and refresh the browser over and over. And that's if you have a good internet to begin with.
And a desk job, because if you're working with your hands, you're not going to be
right. And so I think a lot of people just got burnt out. And so I think that if it was just so simple and so easy, people would just just do it. I think if they rolled it out.
But isn't that changing now? Like now our municipal town is giving it. Oh,
you know what I mean? It's
the market is saturated. Those who were going to get their vaccines already got their vaccines by now. They killed themselves to get it. It was really hard. And now that it's becoming easier, people who
Yeah,
aren't,
it's like, it's already, it's in the rear view mirror, it's like, had people been able to go to the pharmacies and get this from the beginning, like a lot of old people got left out because they're used to, like my dad and his wife weren't able, when they finally made up their mind and saw that, okay, this is not killing anyone, great,
okay,
they drove to a pharmacy because that's what older people are used to. They're used to going to the pharmacy, filling out the form, with just like your flu shot.
right.
They unfortunately screwed the pooch with that. And so there's just so much misinformation now that I think people have just been turned off. So I think if they offer it everywhere, like I'm starting to see these little vaccination pop-ups, you know,
Oh,
you know, if you
I
can
wish
just
they'd
do it
had
in the middle of your
vaccination
day.
pop-ups 4 weeks ago.
Yeah, well, they're able to do that now because of the J&J vaccine, you see.
Okay.
Because it's one shot, you get them and you don't have to worry about them coming back in 3 weeks or 4 weeks. It's like you give them the one shot and it's done. But
Okay.
yeah, that's what I think it is. I don't think it's necessarily educated, not educated. I think people are just burnt out. And I think if you just made it so easy that they don't even have to think about it, that I think more people would do it.
Okay.
Yeah.
All right. That's good to know. My parents, they had it in their facility, but they're, seniors and their facility, but, they came to them. It was CVS that did it. They sent out their team to the facility and they got their vaccine there.
Oh, that's great. So they went to
Right.
the center and did it. See, that's what I'm talking about, making it easy for people.
Yes.
And they haven't really
A
done
lot
that.
of people, a lot of seniors, they're not mobile. They're not
Right.
mobile. Yeah.
Right.
So
yeah, and they're not going to be on their phones clicking to make appointments. I mean, people want to be able to pick up the phone. That was one thing that I liked about New Jersey is they realized that seniors were not doing the computer thing.
Right.
So they made a hotline that people could call and make an appointment. And I just don't understand why they didn't do that here in New York.
Are you telling me in New York you had to be tech savvy to be?
Yes, absolutely. Yeah.
That a ton of people.
Yeah, exactly.
Wow.
Yeah. So that's what I think. I think that make it easy and they will come. That's my thought on it.
That sounds reasonable to me.
Now onto the topic du semaine, or de la semaine, right? Colon cancer, colonoscopy, and other ways of screening. So I think I told you that, I interviewed the president of the Colon Cancer Foundation.
Wow. Yes.
Yeah. Did you know that there's a lot of early onset, like they're finding people younger and younger, 18 years old.
What?
17 years old.
That I didn't know. I've been hearing that it's getting younger, like more like people in their 30s and even 20s.
Yeah.
That I didn't hear.
What's
that about? What did she say about that?
Which means you have to, if you have high risk, you've got to have the conversation with your teenager, for heaven's sake.
Oh, man.
At what age do you have that conversation? 13, 15, and they're not sure what this explosion is. They're looking at different reasons, but a couple of questions that I had for her were like, 45 is great, because that was what the meeting was about, that they're
right.
They're happy to say that the screening guidelines had now say 45 instead of 50. And then there's no real, doctors will say every 5 years if you're high risk.
Okay.
But there really is no guideline. The American College of Gastroenterology doesn't really, the American Cancer Society does not really have, they don't really have a guideline of how often, what frequency you should do it. They leave that kind of up to your doctor and your history and stuff. But if you have symptoms, they say, you should absolutely get.
What are the symptoms?
So symptoms really range and vary. Weight loss.
Oh.
Pain, back pain. Depends on where it is, inability to eat. chronic constipation, which I know that's a, that doesn't,
Mhm.
I think the point is that if you have the bleeding, rectal bleeding, or vomiting, or the symptoms just vary. It's a wide range of symptoms. But if you have any symptoms that are out of the ordinary, that you should absolutely discuss them with your doctor, and then your doctor should absolutely say, okay, I'm going to send you for colorectal cancer screening or endoscopy, or something. But I even the thing though is, like, even if you do that, what happens if, like, say Chadwick Boseman, so 45 is great, but what he died at 43 with and he was diagnosed with stage 3.
Right? In his prime, a man in his prime.
Yeah.
That's just unbelievable.
Yeah.
But apparently not that unbelievable.
Right. Yeah. Because so many people, now she said that there's 21 million more people now, yes, as a result of this change, that
Wait, what?
21
Explain
million.
that.
Yeah, she said 21 million, more people now in the healthcare system that need care for colorectal cancer as a result of
Wow.
as a result of A, the change, and B, just younger and younger people, developing the disease. It's terrible. It's terrible.
That's a huge number.
Yeah. My neighbor, she was recently diagnosed with, it was stage 0 to stage 1.
Okay.
But
Scary.
but the freaky part about it was that she so year 0, like we'll call it year 0, she had a clean colonoscopy.
Okay.
Years 1 through 4 was when she lost weight.
Okay.
In an unexplained weight loss weight. She started having symptoms. She started having rectal bleeding, and she went to the doctor, and they removed the polyps, and every single one of her polyps tested positive for cancer. Because they go in, they snip.
So between year 1, which was clear, and year 3, year 4, all that happened.
Yeah. Mm-hmm. Yeah.
That's fast.
Yeah. And so thank goodness it was just stage 0, stage 1, but she wasn't due back for her next colonoscopy until 2022.
What made her go? Oh, because she had symptoms?
Because she had
Is
symptoms. But what if she didn't
have symptoms? Oh,
Exactly.
wow.
That's absolutely scary. I'm not.
Do we know if she had a family history?
She does have a family
so
history.
like paying
Her
attention?
mother died of colon cancer. They found that out, post-mortem. They found that because they didn't know. They thought it was hemorrhoids, And then when they went in afterwards, they're like, oh, yeah, it was colon cancer.
Wow.
Yeah. But with that history, her doctor felt comfortable saying, okay, see you in 5 years.
Oh, that makes me want to schedule one right away.
Yeah. And I'm not even, she's okay though. She's okay. She had the resection surgery, and she is wrapping up her chemo. So that's great. But it's, I just go back to, like, suppose she didn't have symptoms, So I don't know. What do you think?
That's crazy.
Yeah. So screening is starting earlier at 45, which I think is great. I wish it were 40, but
What's is there an organization that allows that, informs you when you should be getting it, when you should be getting your screenings, and are they changing?
Well, so
what the paradigm is?
So the American College of Gastroenterology, they've been making recommendations since 2005 to lower the age from 50 to 45.
Mhm.
But because it was, they were finding a lot of Black people were coming,
Mhm.
were being diagnosed with colorectal cancer, and their prognoses weren't that great. They were dying a lot more than their white counterparts. And so they pleaded in 2005, and then they pleaded again in 2008. So what is that? That's like 16 and what? My math is terrible. 16 and 13 years ago, they've been pleading for this. And only just now, the United States Prevention Services Task Force finally said, okay, let's make it 45 for everyone. But just let that sink in for a second. 13 years, 16 years, 16 years of pleading with them. Because what happens is the insurance companies, they take their cues from the USPSTF.
Okay.
So they don't cover anything if they don't say, look, it's got to be covered. I mean, and states can mandate that, certain things be covered, but ultimately, they take their cues from that agency, from that task force.
So if there hadn't been some task force or some agency, what would be the protocol? We don't even necessarily.
The protocol would be 50 they were still saying, look, if you're African American, you need to start screening at 45. If you have family history, you need to get screened at 45. But it was not universal. It was just, if you have a family history, if you have a genetic predisposition, and if you're African American, for God's sakes, don't wait till 50. I don't know how doctors, how gastroenterologists, I don't know if they disseminated that information or if it was just like a case by case scenario. Like, I know, years ago I went to, because I have the BRCA2 mutation, which predisposes me for not just breast cancer, but, also colorectal cancer, pancreatic cancer, ovarian cancer, take your pick, dealer's choice. So I immediately, when I got that diagnosis, I started seeing all these different doctors because I wanted to be on the preventive side of things. And the gastroenterologist said to me, "You're still too young. I would wait." Yeah. So she wanted me to wait till I was 45. Yeah. And so I had to wait. I didn't have any symptoms or anything like that. But what was that your experience? Like, when did you first get screened?
Well, because I had that stage 1B of the endometrial. And so then they said, after I had my surgery, they said, you have to go get a colonoscopy. But I haven't done one since. It was all clear. I gotta get, especially after that story. Oh my gosh, I gotta schedule that. I gotta get right on that.
Really scared me, but the Chadwick Boseman death, that really was a
man in his prime, look, healthy as a horse appearing. Wow.
Yeah. And all the resources that you can shake a stick at.
And a celebrity, right?
Why this fit, affluent young man should have died from. That's why I keep asking, why not 40? 45. Why not 40?
Is it the money issue? Is it insurance? Is it?
Was saying that there's a formulary they work out.
Okay.
For how they came to 45.
Is it a financial formula?
I didn't ask her that. That's a good question, though. I should have asked her that. But yeah, I don't know. I'm not sure. I wish I would have, thought to ask her that question, but that's because that's a very good question. And then I asked her about, like, what can people do in between, the years?
Yeah, what can we do in between?
So she talked about stool DNA testing, which is like the really new conversation that.
Okay.
So you've heard of Cologuard, I'm sure, right?
Briefly.
Yeah, it was like the little commercial with the little box, the white box with the blue, and he's like, "Oh, I had Cologuard," So there's Cologuard. I know, right? But basically, you swipe and you send it to the lab, and they'll let you know if they find any cancerous, DNA in your fecal sample.
How effective do they, how reliable is that? Do they know how reliable that is? What do they claim?
What does Cologuard claim?
Yeah, do we know what they claim, like what their reliability is? Yeah.
Let me see. Cologuard. Efficacy of Cologuard versus colonoscopy. Let me see. So Cologuard can only detect 42% of large polyps.
Okay.
While a colonoscopy can detect 95% of large polyps.
Oh, but it is something to do while you're waiting for your
colonoscopy. But why would they detect polyps? They're supposed to detect cancer cells.
Are all polyps cancerous?
No, they're not. They're not. I mean, when they remove them, which is what the colonoscopy, which is why it's the gold standard. They remove the polyps, and then they biopsy them. And I mean, having polyps is not a great thing, but it's not, you've got cancer. So they remove them, and then that, is a preventive, type measure. They biopsy them, and if they come back cancerous, then it's okay, you've got cancer. But if the Cologuard sort of does the same thing, I'm not sure that that's, is what I'm saying makes sense?
Are you concerned that it's like
talking about a camera,
it's a false sense
with a loop at the end that goes into your rectum and travels through your large colon, and then it grabs a hold of any polyps and just snips them and pulls them out. Cologuard is external. It's basically looking for traces. It's looking for evidence of cancer.
Okay.
From your stool, which if your stool is moving through your system and you've got cancer cells, it's going to bring them out, right?
Mm-hmm.
So I don't know. I understand what they're saying.
Are you concerned it's a false sense of security?
What, the
Cologuard?
No, I don't think so. I think it's
something to do in the meantime.
I think I think you should have your first colonoscopy or virtual colonoscopy, which is what I had. Oh, I have to tell you about
that I want to hear about.
So I got I'm sorry, let me finish my thought. Okay. So you have your colonoscopy, and then in between, you have your stool or your blood tests to check for cancer. And then if there's some change, then you go back in, you have another colonoscopy.
Okay.
Right. So it should be something you do. Or if you're afraid of or uncomfortable with, that kind of an invasive procedure, you do that. And then it's like, okay, what are you going to do? It's either, okay, great, I'm okay, and I'll do it again in another year. Or, okay, I've got something here. I'm going to have to decide now, am I going to do this? Do I want to save my life? So virtual colonoscopy. So I had a virtual colonoscopy. I was originally going to have a colonoscopy, but then when I found out about this virtual colonoscopy,
I had never heard about that before you brought that up.
I had never heard about it until, this place in New Jersey mentioned it on their website. And I was like, why didn't anyone tell me about this? How could people not, my doctor didn't even know about the procedure.
Wow.
I didn't tell him, like, just give me the referral, But the reason that I decided to do the virtual colonoscopy as opposed to the regular colonoscopy was because there is a tendency for, especially if your colon prep is suboptimal, for the loop not to make it all the way to the end of your descending colon into your cecal.
Okay.
And so what research has found is that people of color, Black people, tend to have their cancers on that right side.
So they're
Where the
sampling
leech
the
doesn't get
wrong
to it.
side, or they're not
Right.
sampling all the sides.
Right. So what happens is
Okay.
a lot of doctors are looking on the left side, which is where most, white people, people of European heritage, ancestry, people of European ancestry, they tend to have it on the left side in the descending colon side. People of color, Black people, tend to have it on the ascendant colon.
So they're only sampling one side.
They're not only sampling one side, they are sending it through and going.
Okay.
They're supposed to go the entire length. They don't
Okay.
always make it all the way down there, is what's happening.
Okay.
And so they're missing those cancers. Yeah.
Wow.
And so
That's so
that
scary.
scared me. Yeah. And so that scared the bejesus out of me. And I said, okay, I want something that's going to get an image of everything, and if I have to follow up if they find polyps and I have to follow up with a regular colonoscopy afterwards, I'll do that because those polyps need to be removed. So, getting the whole picture to me was more important than them going in and maybe missing the end. The other thing I found out that was very interesting about myself was I have something called redundant colon, which is essentially the average colon length is about 5 feet.
Okay.
My colon is longer than 5 feet.
Okay.
So there would
The
have
natural variant. Right.
right.
Okay.
And so that would have opened me up if I went and done the regular colonoscopy.
How would they have known? How
They
would they
would
have
not
known?
have known because I would not have known to tell them that. And I found
Okay.
that out doing the virtual colonoscopy. So
Ooh.
yeah, so I'm actually going to end up doing a regular colonoscopy because they didn't factor in that I might have a longer colon. They didn't put enough of the CO2 into my system to infiltrate efficiently because they do it based on the average colon of 5 feet. So I wasn't fully inflated. From what they could see, I didn't have any polyps, but I need to be 100% certain. So now that I'm armed with this information, I am going to follow up and have a regular colonoscopy, and I'm going to have a conversation with the gastroenterologist and say, and by the way, I have redundant colon. What's your plan going to be for how you're going to approach my colonoscopy? So now I can have an educated conversation with the.
Well, that was productive.
Yeah. So that's the one good thing that came out of it. Unfortunately, it was done by. And now I'm not knocking the young lady. She was, she was very professional. She was very helpful. But that's kind of why, some gastroenterologists are like, because my gastroenterologist, when I said I want to do that, she's like, find another doctor then because I don't agree with you. She didn't cater for this variation in my anatomy. She did what she normally does. She puts in, the CO2 and water for 5 feet of colon. I mean, I don't know how many extra feet of colon that I have, but, had she put in more, but there was no way for her to know because it's not like an MRI where you get immediate.
It needed to be imaged to begin with.
Right,
Okay.
Exactly. Well, she did have initial images because they wanted to make sure that my colon prep was, optimal so that they can see. So she went and brought it to the radiologist. She went and brought it to the radiologist to make sure that I could even go through with it, because if it's not optimal, they can't do it. There's just no point.
It's quite a production.
Going inside the body is always a production. But yes, yes, absolutely. I mean, and it took something that should have been a half hour in total and turned it into well over an hour because she couldn't get a hold of the doctor. And then, she's insufflating me. She doesn't know that she's not fully insufflating me and she's taking these images. So that's why they want me to come back and do it again. But if it's gonna be the same experience, there's just no point. Also, how much CO2 can you put into a person safely, right? I'm still, 5'5", 135 pounds. Like,
Right.
I don't know how much more of that would be safe for me. So I think at this point, it's better for me to follow up with gastroenterologists, arm them with that information and say, okay, what's your plan? Because I don't want you to miss going down into this area. Do you have to pipe an extra however many feet to get there? So that's what's that's what's going on there. It's quite a production. Quite a production, I know. What are you gonna? But once I get it established, it's established, right?
Yes.
I'm not
And
happy
you learned something important, the redundant business. That's really, it's relevant.
Yeah. It could have also been a situation, they have something called tortuous, where it's all twisted and stuff.
Oh,
They didn't find
twisted.
that. Yeah.
Okay.
Where it's just so convoluted and so like
Yes.
they would have a hard time snaking it in. I don't think that that's the case, because that's not what was reported in the impression. But the extra, that was a bit surprising. And then they also said that my prep was suboptimal, which
What?
testing.
But you're so vigilant. I know it wasn't suboptimal.
But it's possible that because I didn't know that I had a redundant colon,
okay,
because there was, everything that came up was clear. But it's possible that the standard prep was not sufficient.
Was not adequate. Okay.
Right. So it's not that I necessarily did anything wrong. It's just nobody could know that I had this extra foot or feet of colon. So I don't really blame anyone for that. I just have to start over and do it because I have to establish a baseline.
Smart. Yeah.
I mean, that's it. I've just, and then after that, I can mess around with stool testing or what have you. But, I need to make sure that what they saw is what it really is. They didn't see any polyps. They saw nothing. That's fine. I need to be 100% sure.
So the whole thing was like 30 minutes or 60 minutes?
So the whole thing in total, if everything is normal, and you have, optimal bowel prep, everything is clear. You don't have, tagged feces. Well, the thing with the fecal tags is that they tag the feces so that they know, okay, this is not a polyp. This is actually a piece of feces.
All right. So that takes time for them to tag. Is that what it is?
No. Well, what happens is, so they tag it so they can rule it out. So they don't. Okay. So if it's a piece of feces, inside of you, they know that it's tagged because it lights up differently than a polyp would light up.
Okay.
The barium or whatever I think it's some sort of barium. And they have you drink it, the night before. They give you 3 doses of it. And basically what it does is if you have any poop left inside of your colon, it lights it up. So they know, okay, this is what I'm seeing here. This is a piece of poo, and this here is not. I think the bottom line is they just didn't factor in or expect that I was going to have this extra
anatomy.
And then no one catered for that. There was no plan B, like, this doesn't feel, because how can you know? How
new is this technology? It sounds pretty new.
I think it's about like a little over 5 years or something like that. I was reading from the Gastroenterology Journal, where it was a clinical, paper talking about how when someone has tortuous or redundant colon, that they, if it's a difficult, well, the paper was about what happens when there's a difficult colonoscopy.
Okay.
Difficult being that, you might have a situation like me where you have a redundant colon, or you have a tortuous colon where they can't get the scope all the way, because the goal is to get it all the way to the end, to the cecum, and if they can't get it all the way there, then that's not a successful colonoscopy.
It's not a complete colonoscopy.
It's not a complete colonoscopy, right? And so then in that case, they recommend having a virtual colonoscopy. So this may be around, this may have been around longer than thought, maybe it's just been perfected over the last, but I'm telling you, my doctor didn't even know about it, you know, had no idea.
The same.
Yeah, you know, the president of
The prep and the time, it's similar. It's different.
same prep, same time,
Okay.
you know, but you know, instead of having to go under anesthesia and making sure
That's a big deal.
you walk away from it, right? You walk away and you know, you get up and it's like you go, you evacuate, you pass the air,
You evacuate, yes.
and
Part of the fun.
life, exactly, you know.
Right.
And the other reason I'm contesting this whole idea of suboptimal is because for the rest of that day, everything was clear, completely clear. So if I really had suboptimal, wouldn't something have come out? Something would have come out, right? So but in any event, the bottom line was they couldn't do it properly because no one knew that I was gonna have an extra long colon.
Right.
Oh man. So yeah, so those are the things those are the ways you can protect yourself. You know, you have the colonoscopy, and if you don't want to have the colonoscopy, you know, because some people feel emasculated by it, you know, some people
Oh, I hadn't thought of that. Yeah.
well, it's an
That's right.
exit, it's an exit, it's not an entrance. You know, there's that old
There's that
old-
thinking,
yeah.
as opposed to this is just life-saving and it's just a procedure. It doesn't have special meaning.
Right. But
Okay.
but some people feel that way.
Yes.
They feel like it's too invasive.
Mm-hmm.
You know, for some people they're sensitive to the anesthesia, and maybe you
Right.
could do it without anesthesia, but my God, would you want to, right? You know, I mean, you could, but can you imagine
Really?
things snaking? Yeah, there are people who can't have anesthesia.
Yes.
And so because they can't have anesthesia, they, you know, they don't want to, or they do local anesthesia, which I don't even know if that's sufficient for that.
I don't know how that works. Yeah.
You know. But you know, some people feel uncomfortable, but at the end of the day, you still have to get screened. You have to get screened somehow.
It's not an option. It has to be done.
You have to, because in this day and age, like, you know, I was asking her, well, what factors are leading to this increase in
Yeah, I'd be very curious to know.
So they're not really sure. You know, they're looking at diet.
Fiber, okay, diet.
You know, I read something interesting on Stat News where it was an article, I can't remember their source, but they talked about that doctors are looking at the intake of high fructose corn syrup.
That seems to be such the bane of our modern times. That high fructose corn syrup.
Yeah, and then there's a list of foods that are considered carcinogenic. ASCO, the American Society of Cancer and Oncology, they've come out roundly and said there is no alcohol consumption that is not carcinogenic. They had first put into it and they said, well, you know, use moderation. And then they came out.
So all those blue zones where they're like, drink a little bit of alcohol, but the rest of the diet.
But they also have an excellent diet.
Yes, you know, and exercise and physical, yes.
Yeah, yes. They're not exposed to
unprocessed foods, yes.
Exactly.
Okay.
So if you do have, you know, moderate wine or whatever, I mean, people have been drinking wine for centuries, you know, with no problem. So you know, but there's all these cocktails now, you know, there's you know, people are drinking harder liquors.
Right.
You know, it's not just wine anymore. And I'm not putting wine on a pedestal and saying, you know, but that's what ASCO said. ASCO said,
okay,
all alcohol carcinogenic. Being obese is also carcinogenic.
Oh.
Yeah. So they're looking at.
Oh, it's so hard out there.
She
Wow.
also said it's, access to care. Like you have a lot of these medical deserts where, if you're in a rural community, say for example, and you just can't get regular care. So that's some of the stuff that is part of the rise. But yeah, so it's a number of things that they're looking at, but they're starting to look at like diet as a possibility. I think they don't want to get sued by the food industries, but they're kind of tiptoeing out and saying we've got to look at the food supply because we don't know what this is, and patients are getting younger and younger and younger, and it's kind of reached epidemic proportions. Nobody wants to say epidemic, but she agrees with me that this is epidemic. These kinds of numbers. I mean, 21 million additional people is nothing to sneeze at. That's a lot of people.
Yeah, you really have to be brave these days to take a stand on things.
Mm-hmm. But what do you do if you're 20 something years old? You don't know that you have a family history, or you don't have a family history that you're.
I'm sure you don't get tested. You wouldn't think about it. Who thinks about that?
Right.
That's like you have to hear people talk about that. Oh, I'm going to get a test, or you have some relative who went and had it done, and that makes you think about that's a possibility for the future of something that you would do also. If you've never heard of these tests, who would think of it? Did you ever think about that when you were like in your teens?
No, I didn't.
No,
not at all. And this is not. And she asked me an interesting question. Because I've been doing all of this surveillance and so forth. And she asked me, when your gynecologist told you that you were positive for the BRCA gene mutation, why didn't your doctor also tell you? Because he's like, okay, that means that you're susceptible to breast cancer, higher risk for breast cancer, higher risk for ovarian cancer. Why didn't he also tell you that you are higher risk for colorectal cancer? I didn't find it out from my gynecologist.
You did not.
I found it out from the breast oncologist because the breast oncologist ran through all of that with me. And I was so stunned to hear that I had, it also, skin cancer also.
Skin cancer too?
Mm-hmm.
Okay.
Yes. So I see all of these doctors,
Is that because the gynecologist was not an oncologist? Do you think that might be part of it?
Yeah, but that's true. But these are
at this point, they should all be, it's all.
Right. Yeah. And that's the point that she was making.
Okay.
Because these are frontline people.
That's frontline.
Right. The majority of patients are seen by gynecologists, primary care doctors.
Right. And that's it. Yeah.
Right. Exactly. And that's it. Exactly. And so why aren't they? Because I was asking her, like, whose responsibility is it to have this conversation? Is it just that?
That's a good question. Yes.
And she said, yeah, it's kind of a little bit of both. So, we're going to see what we could do to try to, raise awareness, because, this is something that's like extremely serious, and no one can take this for granted. I mean, we saw like what happened with Chadwick Boseman. That was completely stunning. Now you've got 30-year-olds going in and getting their first colonoscopy. I
really just am so curious about the diet and all that related, all the secondary things we get exposed to.
Yeah. Oh yeah. I mean, that's definitely huge. But what do you do? I mean, what do you do? One thing they have found is that a vegetarian diet, very protective. So, you're not going to, they found that vegetarians don't come down with the cancers that meat eaters.
I'm making a little note. Not that I haven't heard that before, but that's
something to think. So I have definitely decreased my meat intake. Decreased. Yeah, I can't go totally meatless. I've got autoimmune issues, so that's it for today.
Okay.
Thank you so much, Jacqueline.
Thank you very much, Samara.
And we'll speak again next week about
All
new
right.
adventures in medicine, in medical research.
Absolutely.
Okay,
Take
bye.
care. See you next time. Bye.